Thank you. Thank you for the honor of serving as your president in this coming year. I am incredibly proud to serve as the president of what I believe is one of the premier state medical associations in the entire country. And what a challenging year it promises to be for those of us in medical leadership. In the 1960s, President Johnson signed into law the Medicare Act. Not since then have we experienced the turmoil and change in our healthcare delivery system. Than that we are experiencing after the passage and affirmation of the Affordable Care Act. This debate continues to severely test our nation's beliefs in how we physicians deliver care, which patients receive our care, and what decider controls our compensation for that care. This indeed is a time of change and a time of challenge. Though the Accountable Care Act is far from perfect, no one can deny that it contains some potentially good things. It makes medical care more accessible, coverage more reliable, insurance companies more accountable, and it strengthens, hopefully, through wellness and prevention, a healthier nation. All good things and no small things. But for the nation's physicians, many big things were left unaddressed. Tort reform, the sustained growth rate formula, ICD-10, and the Independent Payment Advisory Board, and other political hot potatoes. As you know, some states and national specialty societies have fought and refused to recognize healthcare's changing landscape, urging their state legislatures to resist, to block the establishment of the required health insurance exchange. I am proud that WSMA is not among those ranks. Washington physicians know that we do not live in a Goldilocks world. Things are never going to be just right. You remember Goldilocks. The porridge was too hot, the bed was too hard. If she'd been there helping make that porridge, she could have had it at a temperature more suitable to her liking. If she'd invested time going to the store and testing mattresses, she'd have been able to voice her opinion on the one that best suited her back. If you aren't there when others are making decisions, you may not like the decisions the others make. Thankfully, physicians in Washington state have long recognized that we want a healthcare system that best serves our patients and ourselves. We must work within that system. And we have a track record to prove that our involvement pays off. I'm reminded of what Cindy Marcus said when she became WSMA president several years ago. She said that during her time on the board, she had seen WSMA emerge as a leader in our state, become the go-to organization for helping solve our state's healthcare challenges, and grow to be respected and recognized in Olympia. Today, WSMA is not just a presence. We are a force in shaping healthcare policy in our state. Just look at the track record of what might have happened if there hadn't been a WSMA. As Doug said, there'd be no Physicians Health Program. ED physicians, as of this past year, wouldn't be being paid for some of their necessary services. There would be no PI, Physicians Insurance. And Primera would likely be a for-profit company today. I think this is a track record we can be proud of. Now, this next year, we must focus on some things. The most important of which, in my mind anyway, is the insurance exchange. A large portion of healthcare will get purchased through the exchange. Smartly, WSMA has been on board early to help the legislature set up and shape the model that we'll be using. Because your leadership knew that the ACA itself was not about making healthcare affordable. It's about giving people access to healthcare. It's health insurance reform. Cost is a completely separate issue. And what about the cost issue? Why is healthcare in the United States so expensive compared to the rest of the world? The explanations, I think, are many. Defensive medicine, overuse of the emergency department, patient expectations are among them. Another big driver, though, is overuse and waste. A recent, just last week, Institute of Medicine report finds that the healthcare system wastes $750 billion a year in unnecessary, redundant, or ineffective care. I don't think government can control healthcare costs without our help. The challenge is how do you strike the right balance while we're extending coverage to 35 million Americans under the ACA and then bringing in the ever-increasing problem with healthcare costs. And I think that a big part of the responsibility for that problem lies squarely on our shoulders. We are the ultimate insiders. We know there are too many unnecessary tests and procedures. I've had that conversation with many of you this weekend. No one disagrees. We know there's waste in the system, unsupportable variation, overuse and misuse of technology. Admittedly, some of this is the shameless attempts of a few to pad their incomes. But more often it's a matter of just not knowing a better way. I don't think we've done an adequate job of educating one another. For example, for some time in the last couple of years, I've noticed that I was seeing a kind of a string of kids coming into my orthopedic office with back pain and MRI scans, which I really didn't think they needed. So last year I put together a grand rounds kind of talk and gave it to our pediatricians in Pierce County. Some of you in this room were there. We talked about the use of advanced imaging for back pain and when it's appropriate. The result? Well, I think my colleagues really appreciated the effort to help them improve their practice. And I'm really seeing quite a large drop in the number of unnecessary MRI scans that are showing up in my office. At $4,000 to $5,000 a pop for those MRIs, we're talking about some real money that's being saved. And it's better care. I'm asking each of you to get this message out. The tests we order are not free, they're not without risks, and they're sometimes not necessary. And this is something we can all do. We can teach each other. The specialists can help the primary care docs understand what's better, and vice versa. I am thrilled this morning to announce that the WSMA is launching a new campaign to get patients and physicians talking about the appropriate use and care. The campaign is called Know Your Choices, Ask Your Doctor. You've seen the poster outside, I hope. It focuses on 3 initial initiatives: the National Choosing Wisely campaign, the ER is for Emergencies campaign, and some work on improved palliative care and end-of-life care. Know Your Choices, Ask Your Doctor is about helping patients be more informed about their care decisions, whether it's getting an MRI for their back pain or understanding that there are other choices besides going to the emergency room at night when unexpected care is needed, or to make better informed choices when serious life-limiting illnesses occur. The WSMA is going to be working with the various specialty societies, the county medical societies, the Hospital Association, Puget Sound Health Alliance, and others to get this message out. Today, the House is going to be voting on a series of bylaws and bills. I realize that these have been controversial, emotional, maybe even fractious. Whether or not these things pass, I want to reassure everyone here that I and the rest of the Executive Committee are committed to rekindling the spirit of mutual support, respect, and collaboration with the counties, county medical societies, and with the specialty societies. Campaigns like Know Your Choices, Ask Your Doctor simply cannot be as effective if we don't work together and collaborate on getting this important information out. You know, medicine's not a math problem. There's no one right answer to every question. Often there's more than one way we can manage patient care. I think that when we bring our collective wisdom together, we can usually find ways that best serve our patients and while still being good stewards of the scarce healthcare resources and dollars. And I really believe we're up to that task. Speaking of good stewards, I would be remiss if I didn't talk a bit about the leadership changes that are happening within the WSMA. Doug spoke to you about it yesterday and again a bit this morning, and I'd sort of like to offer my thoughts as well. We all know that WSMA is a membership-driven organization, but the truth is that we also know the vital role that our professional staff play in that process. The smoothness and effectiveness with which physician leaders can operate must be credited to Tom and his staff. For 25 years now, Tom has been the guy behind the scenes. He leaves a few fingerprints or thumbprints, but you're always aware of his presence and administrative skills. What I have come to admire and appreciate most about Tom is that he always puts WSMA's interests first. And his first priority when planning for his retirement was to ensure that the association remains in good hands. That he has done. Quietly and systematically, he has groomed Jennifer Hanscom to move into the executive director seat. Most of you already know Jennifer from working with her over the past 16 years. From communications and marketing to finance and the foundation, Jennifer knows all the parts that it takes to make up a successful organization. For the last 4 or 5 years, Jennifer has steadily taken on more responsibility at the WSMA office. She has clearly demonstrated the leadership skills necessary to assume the role of CEO. With the gentle touch, which becomes firm when needed, she is known for being able to get things done. I also suspect that as the mother of 3 kids, she is well suited to corralling difficult positions. Those of you who have worked with Jennifer already know and are aware that she knows her stuff and is ready to help us take our association forward into the future. So please join me in thanking Tom for his many years of service and in congratulating Jennifer on her new position. There are some other people I think I should thank as well. Doug has been an absolutely marvelous president to work with. The executive committee, great organization. The board of trustees really appreciate the help, advice, and support. The docs of Pierce County have really helped me get started in the organization, especially Sue Asher, my county exec, who's really been my kind of rock and sounding board when things come up. And I also want to offer thanks to my colleagues at Multicare who are really going to make this possible by allowing covering for me, so I've got the time to go do what needs to be done. My colleagues, I am so appreciative of your confidence in me, your continual support of my efforts to represent you, and most of all, for the rich friendships that I have formed while working beside you on behalf of